Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. I'm Ariel, an exercise oncology educator, and today's conversation is on chronic adaptations to exercise. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, and it's important to consult with your medical care team for more in-depth guidance and advice. Let's get started. Chronic adaptations are the long-term changes the body develops from regular exercise performed over weeks, months, or years. And unlike the immediate response that happens during or right after a workout, these changes are more lasting and reflect how the body adjusts to repeated training. With regular exercise, your neuromuscular system adapts by improving communication between the brain and the muscles. Your brain gets better at telling your muscles when and how to work and activating the right muscle fibers at the right time. This improves motor unit recruitment, building muscle memory, and makes movements smoother and stronger and more coordinated. Over time, tasks like lifting a heavy object feel easier because your muscles know exactly what to do and your body becomes more efficient at performing the movement. The muscular system and the chronic adaptations with exercise. With regular movement, your muscles adapt to getting bigger and stronger, and this happens because individual muscle fibers grow. This is called hypertrophy, and your body becomes more efficient at using protein to repair and build muscles over time. And again, over time, these changes can improve body composition, meaning you gain more lean muscle and reduce body fat. An example of this, your muscles getting bigger and stronger. After months of strength training, climbing stairs will feel easier. Chronic adaptations to the skeletal system with exercise. When you exercise regularly, your bones respond to the stress by building more bone tissue. This makes them tougher and less likely to break. Your body also consistently breaks down old bone and builds new bone, and exercise helps tip the balance toward more bone formation, especially in areas most used during activity. Stronger bones support your muscles and joints, which help prevent injuries and improve balance. Examples are walking, running, and jumping, climbing stairs, or lifting weights that create stress on your bones that stimulate growth. Chronic adaptations to exercise, specifically the cardiovascular system. Regular exercise makes your heart stronger, allowing it to pump blood more efficiently. This allows your heart to become stronger and more efficient. Over time, this means your resting heart rate gets lower because your heart doesn't have to work as hard. And you'll also recover faster after activity since your body becomes better at clearing out waste products like carbon dioxide and lactic acid, leaving you feeling less fatigued and tired after movement. An example of this is walking or running feels easier after months of regular training. Chronic adaptations to exercise, specifically the autonomic nervous system. The autonomic nervous system controls body functions you don't think about, from heart rate, breathing rate, digestion, and stress response. Within your autonomic nervous system, you have a sympathetic system and a parasympathetic system. Your sympathetic system is your fight or flight response, and this activates when your body senses stress or danger, increases the heart rate, breathing, and alertness. So over time, as you exercise, it decreases sympathetic activity at rest. So your stress response calms down, lowering stress hormones like cortisol. And it also, like I mentioned, has a parasympathetic system, your rest and digest. So this activates during relaxation, helping your body recover, repair, and recharge. So the more you exercise over time, you will see an increase in your parasympathetic activity. Recovery improves, sleep quality often gets better, and your body handles daily stress more easily. An example, after months of exercise, you might notice you feel calmer after a busy day and recover faster from physical activity. Thanks for tuning in. I hope the information has brought you clarity, comfort, and encouragement. Your health and well-being are what matters most, so please continue to take care of yourself and holding on to hope. Now let's transition into some gentle movement. Today's routine is a sample from our Maple Tree On Demand library located on our Maple Tree Cancer Alliance app. Subscribe monthly or yearly to access safe, empowering exercise videos for every stage of the cancer journey. Ready to join? Click the link in the description or scan the QR code to get started. Now let's get moving.
Hi, I'm Sivia, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 3 of our 12-week yoga program. This week we'll be focused on being strong and stable, and we'll be on the floor for the entire exercise. In addition to the floor space, you'll also need a yoga mat. For modified movements, it might be helpful to have a pillow or a folded up blanket close by. The following exercises are meant to be pain-free. If you notice any pain in any exercises, please skip and go back to what felt good. There may be some discomfort, especially after surgery, but there shouldn't be any pain. Let's get started. Okay, so we will get started in an easy seat position. Whatever leg feels comfortable here on top, it will work for you. So we'll just start with our 3 cleansing breaths, in through the nose, out through the mouth. I personally like to close my eyes, but if you like to keep them open, that is okay. So we'll inhale, and we'll exhale. Breathing in the positive energy, exhaling any negative energy. One more. Good. From here, we're actually just going to move straight to our backs, however you would like to get there. Extend the legs, extend the arms, full body stretch on an inhale. And from here, we're going to bend both of our legs. Instead of up, we're going to let them fall out. And both of the heels of and the bottoms of your feet should be touching. If there's too much pulling on your hip flexors, you can take either 2 blankets or 2 pillows. I'm using 2 blocks. And you place them right under the knees, just like that, to kind of alleviate any pressure that you might be feeling. So we'll take a breath here. If this feels good, stay here. If you'd like a little bit more of a challenge or a stretch, you can place your hands right on your thighs and add a little pressure, elongating the spine. One more breath here. Good. If you were using blocks or pillows, you can take those out. And then we're bringing our legs up and putting both of our feet right behind our sit bones. And we're going to do something called windshield wipers. We're just kind of moving these hip flexors and our pelvis. We're kind of waking them up a little bit. So we'll go left and we'll go right. On the inhale, bringing to neutral, and on the exhale, going down to left, and then going down to right. Let's do one more on each side. When you get back to neutral, you can align your pelvis a little bit, scoot it to the left, and then we're going to take our knees to the right for a supine twist. Again, if this feels like it's too much, you can put a pillow or a block under your legs to alleviate some of that pressure. Your arms can come out to a T, and for a little bit more of a stretch, you can turn your head to the left. And we'll take a couple breaths here. On your next inhale, we'll come back to midline. Adjust your pelvis, scooting it a little to the right, and then your legs are going to go to the left. Head can turn to the left, arms out to a T. On the next inhale, we'll come back to neutral, keeping your legs nice and planted, bringing our arms down to our sides. We're gonna do 2 bridge poses, and we're gonna hold at the top of the bridge pose for about 3 to 4 seconds. So on the inhale, we're gonna slowly bring our hips up, stabilizing with your shoulders, holding here for a couple breaths. If this feels like too much, you can add a pillow or a blanket under your low back for something called a restorative bridge. One more breath if you're here with me, and lower down. And on the inhale, we're going back up. And on the exhale, lower slowly down. Let's bring our knees into our chest, squeeze. And from here, we're gonna sit up into our easy seat. If you started with the right leg under the left, let's do the left leg under the right for a little symmetry. Once you kind of get in a neutral position, sit bones on the floor, spine nice and long, shoulders relaxed. We'll bring our arms up and we'll reach down for a forward fold. Again, if you are not all the way down as far as me, that's completely okay. You just want to feel the stretch. One more breath in and out. And slowly roll yourself back up. Good. So from here, we're gonna go into a tabletop. So for you, you might just come forward. I'm gonna rotate this way so you can see better. So we've been in tabletop before. You want your wrists under your shoulders and your knees under your hips. So we'll just start with some cat and cows. So on the inhale, you'll drop your belly and lift your chin. And on the exhale, we'll tuck the chin and round the spine. We'll do 2 more. Good. From here, we're gonna push back to child's pose, but only for a moment. And then we're gonna do something called puppy pose. You're gonna be lifting the pelvis up off of the back feet like you would in child's pose. So it's a little bit more of a shoulder stretch. If you need to return to child's pose for a moment and then come back to puppy pose, that's totally fine. We'll take 2 more breaths in this position. From here, we're just gonna push right back up to tabletop. Finding a good stable base, we're gonna move into right and left lunges. So if you have any knee pain or knee problems, you can bring a blanket. You might not need it for both knees, maybe just one, and you might not know until you actually do it. So from tabletop, we're gonna lift our right leg and we're gonna bring it in between both of our hands. But before we lift up, we're gonna make sure that our right foot is pretty centered between both of our hands, and we have a good foundation in our left knee. So from here, we're just gonna come straight up with our arms. Your right knee should be tracking over your right ankle. And we're reaching with our arms up high. On the exhale, We're gonna twist to the right, dropping the arms more parallel to the floor, and we're gonna hold here for a bit of a twist. On the next inhale, we're bringing our arms back up, reaching, and we're doing the same thing on the left side, dropping the hands, arms are parallel to the floor, holding here, feeling nice and stable. I know I can feel it in my thigh right now. We're gonna take 3 breaths here. On the next inhale, we're bringing both of our arms back up. We're reaching, and we're gonna deepen in the front stretch. So you're gonna feel more of a stretch in the left thigh. You're gonna push forward just a little bit, and then once you feel it, you're gonna push back, and we're gonna go right into half split. So you're gonna straighten the right leg. Your arms are gonna come down, and you're gonna plant them on the mat, and your right foot is gonna come up. If this is enough stretch for you, perfect. If you need a little more, bring that right leg, scoot it back a little bit, and your pelvis can go on your left heel. One more deep breath here. From here, we're coming back up and we're moving back into the lunge. Hinging forward, feeling it in the left front of that hip flexor, and moving back in to the split, the half split. So you're gonna kind of go at your own pace here. You're gonna move to the half split, then come back to the modified lunge. Breathing with each movement. So if you exhale right here, you're gonna inhale when you go into the split. Let's do one more of each. And then we'll meet back in tabletop. Good. Once we're back in tabletop, let's push back into a child's pose for just a minute of rest. When you're ready, on the inhale, we're coming back to tabletop. Recentering, regrounding in, making sure our alignment is good. So we're gonna do everything we just did on the left side now. So we're gonna lift that left leg and we're gonna bring it through both of our hands in the middle. Before we come up, make sure you're feeling good and stable. I'm going to show you how to use this blanket. Just the knee goes right on top there. Adds a little bit of padding. Okay, so once you're ready to come up, we'll bring our arms up all the way high. Holding here for a bit, making sure you're stable, reset if you need, readjust anything. On the next inhale, we're gonna drop and we're gonna bring our arms parallel with the floor for a twist. On the next inhale, bringing back up to center and going to the opposite side. On the next inhale, bringing the arms back up, reaching, and you're gonna push into that left leg for more of a stretch. You're gonna feel it in the right hip flexor. Drop the hands down, straighten the left leg, push back into your half split. From here, we'll do our own flow. So we'll push back up into the lunge, feeling in that stretch, and at your own perfect pace, go back into your half splits breathing on each movement. Let's do one more on each. And then let's push back into tabletop. We can get rid of our blanket. From tabletop, we're just going to push back into child's pose for a breath or two. Quick rest and reset. Okay, when you're ready, on the inhale, let's come back up to tabletop, and then we're just gonna find our easy seat again. From here, we're bringing our arms up, nice and tall. Hands go behind the hips. And we're leading with the chest and lifting the chin. These are called heart openers. When we sit throughout the day, sometimes our posture can kind of hinge forward a bit. So this is a little bit of a counter pose to help with that. Let's do one more breath. Coming back to neutral, we're going to extend both of our legs. And we're going to do the same thing with our legs extended. It just feels a little different. It stretches a couple different things. So hands back behind your hip bones or your sit bones. Chest leads, chin up, and neck back, if that feels good for you. Let's take 3 breaths here. You can add in your own little movements. You can rotate the neck, shake the head, yes and no, if that feels good. And release. Good. From here, we're going to go into a boat pose. So coming out of our long sit. This is a little bit more challenging. We're sitting through our sit bones, and we're going to pull back and lift the legs up. Arms come parallel. If you're able to hold it here, perfect. Breathe. If not, you can stabilize with the right leg, bring it back up, stabilize with the left, bring it back up. We're going to hold for 3 breaths. And when you're ready, we're going to slowly lower down. All the way to the floor. Arms go up, full body stretch. Good. Let's hug our knees into our chest. Let's rock side to side. And rotate the knees clockwise. And then counterclockwise. From here, let's plant both of our feet onto the floor. We're going to kick up our right leg. Arms come down to our sides. Point and flex the foot. Rotate the ankle. Might hear some cracks. Go both ways if you're rotating. And then we're going to have the right ankle meet the left knee for a figure 4 stretch. Bringing the left thigh into your chest. Should be feeling it right here in this outer hamstring thigh area. Feels pretty good. If you'd like a bit more of a challenge, you can extend this left leg, flex the foot. If you extend the leg, we'll bend it back. From here, plant the left leg back, and then we're gonna rotate, we're gonna twist to the left. So you're just you're gonna keep the right ankle on the left knee, and you're letting your hips fall, your legs fall to the left side. Again, if you need like a pillow or a blanket to put in between you and the floor, that'd be perfect. If not, you're here with me. We'll breathe here. You can bring your arms out to a T, and for a little bit extra stretch, you can turn your head to the right. On the inhale, we're coming back to midline. Release the right foot back to the ground and lifting up the left leg. Pointing and flexing. Doing some rotation. Going both ways. And then left ankle is going to meet right knee, and we're bringing the right knee into the chest as much as you can. Making sure to keep that left foot flexed. And then for a little added challenge, bringing the right leg up and extending it, keeping both feet flexed. It's more of an active stretch that way. And from here, let's bend the right knee and let's bring it back down to the floor. Keeping the left ankle on the right knee, we're gonna let the legs fall to the right for a supine twist. Arms out to a T, and head looks left. Take a couple breaths here. Good, bringing back to midline, releasing. If you'd like to take another full body stretch, that is totally okay. And then bringing the knees to the chest, and we're rocking up to an art easy seat. If you'd like, from here you can take your Shavasana, find a nice quiet space, turn on some nice music, and take like 5 minutes for yourself. If not, that will conclude the yoga postures this session. So thank you so much for letting me guide you, and I will see you next week. Bye.